Hi everyone, my name is Nick Reveille.
My name is Luis Dominguez.
And my name is Johnny Soren. Welcome to the tour of the University of Delaware's Science, Technology, and Advanced Research, or STAR campus. This building is home base for the Department of Physical Therapy and other programs in the College of Health Sciences.
Today we're going to be showing you our classrooms, anatomy lab, physical therapy clinic, and more, so you can get an idea of what it's like to be a physical therapy student here at the University of Delaware.
The first stop on our tour is the labyrinth, which is right outside of STAR, and is a place dedicated to our anatomical donors that you will meet in your first semester here as a PT student. It serves as a place of reflection, contemplation, and gratitude.
Next on our tour, we're going to take you through a tour of our office spaces here where our faculty and staff work to help us with many things.
All right, so now we are in the PT office. Up in the front, we have reception and a lot of our administrative offices over here, and they all work very hard to help with scheduling, volunteer opportunities, special student projects, and much more.
Further down the hall are our faculty offices. Our faculty have an open door policy and are always available to meet with students to discuss anything ranging from coursework to sharing physical therapy memes.
Hello, I hope that everybody's enjoyed the tour so far. Our next stop is the anatomy lab. So this is where you're going to be spending the majority of your first year during the summer. So follow me. So this is the locker room. Each student gets their own locker at the very beginning of the summer. So this is to keep all of our belongings coming in and out of the lab. Each student wears scrubs, gloves, and we bring our own set of shoes just to keep the outside kind of separate from the lab inside. Kind of keep everything clean. All right, hair's up and we're ready to go in. And this is the lab.
Hi, I'm Bree, and let me show you around the lab. While you're here, these cadavers will be your silent teachers. You'll learn more from them about structures and relationships within the human body than a textbook could ever teach you. And not all PT schools have this opportunity. So sometimes students from other PT schools will come and observe, and medical residents can even come and practice procedures. While you're here though, you'll work in small groups of about 4 to 5 students per one cadaver. Each cadaver is situated under a vent. The vent is going to help get rid of odors and any extra chemicals, as well as operating grade lighting to help us best see structures to help with our dissections. Working in small groups is really helpful because we will dissect the body from start to finish. So it allows every person in your group an opportunity to do some part of the dissection and learn hands-on. While we're doing that, it's not uncommon to find a history of past surgeries or even medically implanted devices, again, helping us learn even more. But we always have a handy-dandy atlas of the human body around just to look at and help us. Every single one of these cadavers is here because the individuals selflessly donated their bodies specifically to UD. At the end of your first year, we will host a service of gratitude ceremony in which we invite the loved ones of these individuals to come to STAR to honor their donation. Follow me and we'll head to the bone room.
Welcome to the bone room. This is where we keep all our bony specimens. It keeps them clean from debris from outside so they don't get contaminated. Here we like to visualize different bony landmarks as well as different attachment points of different ligaments and tendons. It also is a great way to visualize what we see on the body, and we can take what we learn in here and bring it out into the lab. So let's head back out to the lab to take a look at some joint preps.
Hi, my name is Ryan. I'll show you the rest of the lab. The room is equipped with projection screens and cameras that allow our professors to show us specific details on the cadavers or different joint regions to the entire class at the same time instead of all of us trying to crowd around at the same table. Over here we have our joint prosections, which are detailed dissections done by our course instructors and professors, allow us to see the intricate details of different joints or body regions, just like how a ligament can resist certain joint motions or how the spinal nerve exits a vertebral foramen. At the end of this hallway, we have our laundry room, which allows the students to do their laundry and wash their scrubs between classes. I'm gonna walk you down to the classrooms at the end of the hallway, so I'm gonna go get changed and I'll meet you on the other side. All right, this is the main physical therapy hallway where all of our classes will be held. So down this hallway, each of the students will get their own locker where they can store either their books, a change of clothes, their lab equipment, or snacks, or whatever they really want to. As you can see, we have some students here. This will be an area where you can interact with students, or with faculty, or even just hang out between classes. We also have countertops along the wall here where we can do work between classes. And here we have a main lounge where you'll see students practicing different mobilizations or doing their coursework. Our classes are just right down here. And I hope you enjoy the rest of the tour.
Hi, my name's Caitlin Walsh and I'm a second year in the UDPT program.
Hi, I'm Sydney Small and I'm also a second year in the UDPT program.
And we're just here to show you a little bit about our classrooms and where we spend a lot of our time in the program and where we do our learning. And down these hallways we have classrooms 231 and 232, one known as the desk room and one known as the plinth room.
Yep, and you're gonna follow us to see them right now.
Come follow us. It's right through this door, so this is gonna be 231 and this is our desk room, as you can see here. So most of our lectures are going to take place in this classroom 231 throughout the year. And there are no assigned seats. As you can see, there are a lot of options, but many people are really particular about their seat. And this is actually mine. And Sydney sits right over there. Hi, Sydney. All right. You can also see around the room, we also have a bunch of TVs. And during lecture, we have these TVs on, and the PowerPoints are on throughout the lecture. So if you can't see anything or you miss something, just look to your left or to your right and everything is where you need it.
All right, and also in this room, as you can see, there are plinth tables back here so you can practice anytime you want, either early mornings or if you're a night owl like me, you can come and practice these skills because this room is open to you anytime you want. And as you can see I'm doing right now, a shouldered mob, which you will be learning soon enough. And also in this back closet, you'll become very familiar with the wide variety of stuff that we have that we use for acute care practicals. So like I said, these rooms are open anytime, so you can grab all this equipment in here like crutches, walkers, and oxygen tanks to practice with. And we're gonna go check it out right now. Oh, and look, there's Caitlin taking down a nice walker for us.
Make sure you grab your stuff quick because it's gonna go fast.
Oh yes. And the next classroom that we're gonna see is 232, which is also known as our plinth room.
Let's go. And so this is 232, like we said, the plinth room, as you can see, also known as tables. In this room, we do perform a lot of manual techniques, anything from manipulations, mobilizations, goniometry, soft tissue massage, everything you'll need when you are in your ice down in the clinic. And in this room, we also do have lectures, including our biomechanics lecture was in here sometimes, musculoskeletal eval course. You'll learn all about that once you're in the curriculum. And we also have some cabinets here in the back that have things such as IV lines, goniometers, and gowns. So you can find that whenever you need it right in the back.
So you're back with me. So after Caitlin said, there are a lot of things that you can do in this plinth room. Another one that you can do is attend events that we have on the weekends called Round Robin. So that's where we pair first year students and second year students together to practice those basic evaluation skills like Caitlin said, including joint mobs and manipulations. So that's just to prepare us to go downstairs to the clinic when we do have our ice rotations. And so we know PT school is a pain in the neck. You can also practice suboccipital releases on each other in this plinth room as well. And so because we are big on biomechanics, these plinth rooms raise, oh my gosh. So in those 4-hour-long lectures, you can stand in the back of the classroom and you can type your notes right here, and you still have all the screens that we did in the other room in 231. Thanks for joining us on our journey of touring room 231 and 232.
And we hope you enjoy seeing the rest of the building, and thanks for joining us.
As you walk into STAR, you're greeted by this large hallway that houses our PT clinic as well as a lot of the research labs that we have here on campus. If you're interested in learning about any of the projects going on, we have this wall of flyers. And if you're interested in participating, you can also find out more information here. It's really cool that all of these research labs are right across the hall from our physical therapy clinic, because you can really see how all of the discoveries that they're making can quickly and easily be implemented into our clinical treatment to give our patients the highest level of care.
As you can see, the labs here have big windows, so visitors walking down the hallway can see directly what's going on. Here is an example of a lab. This is the virtual reality and gait orthotics lab. As you can see, it features a treadmill, a harness, and a virtual reality cave. Also located in this hallway are a nurse-managed primary care center and a cardiovascular lab. At the end of the hallway, there are many chairs and tables where many students can just sit and relax and study. And as you continue down to the hallway to the right, you will eventually get to the Audion, which is the lobby of the Star Tower.
Hi everyone, so I'm going to show you the first floor of the tower. So to my left here, you see a kiosk where they have a lot of snacks and kind of drinks that you can use while you're studying. It's a very convenient option for students. I'm going to show you the rest of the first floor now. You can follow me. And up here you see the plant wall here. It has over 5,000 plants. And here's a very convenient option with lots of seating where you can study. And there's some booths and some tables depending on where you would like to study. And then up here we're coming on the Audion. So this is kind of the location where we have lots of student services such as the donor memorial, which is right in here. And then you can walk in the doors on the side. And then now I'm going to show you the fourth floor, which is arguably the best spot to study. And to my right, you'll see some of the PT students studying right here. Okay, so this is the fourth floor of the tower. So this is the nursing floor where the PT students kind of collaborate with the nursing students for some assignments that we have throughout the semester. You can follow me. So this floor has a lot of convenient options such as a full kitchen on this side, and it also has a really good view. So you can follow me over here, and here is a table with a fridge for your lunch and then a microwave and sink. That will kind of help you if you're doing long days studying over here. And there is also a little conference room right here where you can study and kind of be away from all the chaos. And then I'll show you the bigger conference room on the other side if you wanted to work on kind of group projects and things like that. This floor is where we have what's called healthcare simulation, and it's an assignment for one of our classes where we collaborate with the nursing students to kind of get a full healthcare approach and give us some experience collaborating with healthcare professionals. And then here's the big conference room, which has arguably the best view for studying. And here is some other options and rooms that you can also study in. Alrighty. Okay. And that is all I've got for this floor.
Hi there. Welcome to the University of Delaware Physical Therapy Clinic. UDPT is a fully functioning physical therapy clinic that provides a unique environment in which students, physical therapists, and residents treat patients from the university and the surrounding community. This is also where we, as students, take part in part-time clinical rotations that are a part of our curriculum. Come with me. The UDPT clinic has two sides. Over here we have our sports and orthopedic side, or S&O, and over here, if you'll come with me, we also have our neurologic and older adult, or NOAA side. Every UDPT student takes part in a rotation on both the NOAA side and the S&O side, as well as a pediatric rotation that takes place off-site. Now together, all three of these rotations comprise our integrated clinical experiences, or ICEs, that take place alongside our classes. Now, treating patients while you're in classes might seem like a lot, but it gives us a really great opportunity to apply what we're learning in real time when we work with a variety of patient populations. Now, also, because UDPT is an academic institution, we see a large number of different conditions, including many that you might not see in your typical outpatient clinic. Another benefit is that we have some of the top researchers in the profession just across the hall that we can reach out to for a consult if we need.
Hey guys, I'd like to introduce you to the Sport and Orthopedic, or as we like to call it, the S&O Clinic. So over here we treat patients ranging from the infamous ACL reconstruction to total shoulder replacements, concussions, and neck pain, and everywhere in between. So in this clinic we have the unique opportunity to work with athletes from across the street as well as high school athletes, which gives us the opportunity to work with higher intensity specific programming for these individuals. And you can follow me over here. So in this clinic, we have the unique opportunity to have 3 biodexes in the back of our clinic. And if you follow me this way, you can also see that we do offer blood flow restriction training, as well as the Ultra G over here, which allows us to adjust the amount of the patient's body weight that they are carrying when performing exercise.
Hi, welcome to the Neurologic and Older Adult Clinic, or NOAA. In this part of the clinic, we see older adults with conditions ranging from post-operative care to general deconditioning, as well as patients of all ages with a variety of neurologic diagnoses, such as TBI, SCI, and Parkinson's. Come on and follow me. Because of our expert clinicians, we as students are exposed to several complex and rare diagnoses as well, which really sets our program apart from others. This here is state-of-the-art equipment called infrared goggles. It allows us to visualize the eyes in vestibular evaluations. If you'll follow me this way. Here we have our parallel bars, which help with training patients for balance. And right here is our body weight supported harness, which allows PTs to train patients at their highest potential while maintaining safety. That's it for our tour of the UDPT clinic. Thanks for joining us.